first power. Does that look right? Not really, does it? Okay, what about 10 to the first power? Does that look
Much of what we know about the way the human body works emerges when it is in need of repair.
Or is it right?
Scott Tennis, a veteran 6th grade teacher and football coach in rural North Dakota, is the victim of debilitating seizures that have led to the frightening discovery of a massive brain tumor. 2 months ago, Scott's tumor began growing rapidly, as did the frequency and severity of his seizures. Often, he would pass out. If left untreated, Scott may have less than a year to live.
I had 3 seizures in 3 weeks, and all of a sudden it was like, whoa, we need to do something.
Scott and his wife Lisa traveled to the renowned Mayo Clinic in Rochester, Minnesota, where high-risk brain surgery has been recommended. The brain is a greedy organ. While Scott's brain makes up just 2% of his body weight, it consumes 20% of the oxygen his body uses. Floating within his skull, its 2 hemispheres contain 100 billion cells, and the eager connections between these cells bring consciousness. But if these connections are interrupted by disease or tumor, the brain misfires, and electrical storms can create havoc within.
Mr. Tennis?
Yes.
My job here today is to put these markers on.
Okay.
Okay, and they create a reference mark on the MR images.
Okay.
Knowing the exact location of the tumor is vital. One wrong move in any direction could leave Scott paralyzed, remove crucial brain cells, or worse.
Okay. Last 2. And we're all set.
Okay.
Thank you.
The MRI scan shows the location of the tumor, but it is essential to identify the specific functions of the area it occupies, and to do so in 3 dimensions. From these scans, a startling 3D visualization of Scott's brain is prepared for his surgeons. This will enable them to see inside from any angle, as if his skull and brain were transparent.
Early on, when I first came to Mayo, I was doing some imaging, early 3-dimensional imaging, and talked to a neurosurgeon and showed him some of my visualizations of the brain and the tumor. And he told me something I've never forgotten. If I can see it, I can fix it.
What you can see is you can remove any plane you want to. So if I want to get the skull off, and then I want to get the covering off, and I want to move down, I just hit buttons that will move me down to just the area I'm working on. It's a totally different picture. It's the same as walking inside a building versus standing on the outside.
Scott and Lisa meet with Dr. Frederick Meyer, who will perform the difficult surgery.
Scott has a brain tumor that's infiltrated through the dominant part of his brain. And it's close to the part of the brain that controls movement to the right side of the body. And it's very close to his language centers. And it's sitting within an area that helps initiate and coordinates motor activity, movements. We can see it starting, this white area here, this is the left side of the brain. This is all tumor here, and here, and here, and here,
Okay.
and here, and here.
The image grimly reveals how difficult the surgery will be. Scott's tumor is in a particularly dangerous location in the cerebrum, the brain's outermost layer, thought to be the thinking brain. The massive tumor lies between the crucial regions controlling speech and movement, and it is perilously intertwined with healthy brain tissue. To avert damage to these areas, the surgeons will need to be able to speak to Scott as they work, and that means Scott will have to stay awake through most of the operation. It is his best chance for a return to normal life.
This is all very controversial. I think it's a very difficult decision. I mean, it's an awful decision that no one should have to make. How serious is it? If he doesn't have successful treatment of his tumor, whatever that treatment is or consists of, tumor is going to kill him. And he's a young man. So it's deadly serious.
Those words just hit me like a ton of bricks. The things that ran through my mind were my kids, my family, and is this going to be our last Christmas together?
Spell the word man.
M-A-N.
Has.
H-A-S.
Back at the Mayo Clinic, Scott is less than a day away from surgery. To give doctors a better understanding of how his particular brain works, he undergoes a series of basic cognitive and language tests.
Say they raise good potatoes.
They raise good potatoes.
Will you answer the telephone?
Will you answer the telephone?
I ordered a ham sandwich, a glass of milk, and a piece of apple pie.
I ordered a ham sandwich, piece of apple pie, and a glass of milk. Penguin.
This knowledge will enable the surgical team to perceive change, signs of danger, as they talk to Scott throughout the operation.
Snail.
I wish he didn't have to be awake and he could just put him to sleep and do it and be over with, but yet have the same results. I mean, it's gonna be tough.
I need to be conscious through the whole thing. I'm not sure exactly how it's all gonna go, but that's very intimidating. Wheelchair. Pelican. Dog.
Do you know how many images your eye has seen since you were born?
Saw.
Do you know how many sounds you've heard?